Okay, good morning, doctors. I'm very happy to have you on the program this morning. Welcome to this morning's program. I think it's a very significant program. The three most important factors when making an orthopedic pain management referral for your patient. We're going to be very happy to have Dr. William Donovan, who's a Board Certified Orthopedic Surgeon at Spinal Kinetics in our programs now. We're bringing in national experts in different areas of spinal care. And Dr. Donovan, as you will see as I go in this webinar this morning, is one of the foremost experts in really bringing some significant advancements into the pain management, pain intervention area of practice. And one of the things that makes it so exciting for me is that he's really interested in patient results and patient safety. And he's actually started two companies. One is called Spine Injury Solutions. That's a publicly traded company that deals with just that, injury solutions. That's everything that Spinal Kinetics is about. That's why these programs align so nicely this morning. And that's why we're looking for national experts such as Dr. Donovan to bring on to these webinars to give you more information about ways that you can help your patients more in your own private practice. Those of you that are new to these webinars, my name is Dr. Cronk. I'm the Director of Education for Spinal Kinetics. We're the #1 spine and ligament injury testing company, medical company in the country. And I'm also the CEO of American Spinal Injury and Impairment Consultants, and I do a lot of online training specific to spinal ligament injuries. Now, everyone knows spinal injuries are very, very prevalent in the country, any country you want to look at, but in America today. You know, overall, there were 65 million healthcare visits were made for musculoskeletal injuries in 2010. Injuries are a really important area. We know that when the spine is injured, the most problematic thing that the patient can have is a thing called a clinical instability. As a matter of fact, Spinal Kinetics science-based injury technology is all about helping doctors to locate those spinal instabilities. Anytime you're doing treatment, you want to know exactly where is the problem, and you want your imaging, whether you're using MRI or using excessive motion testing, and we've taught a lot that you have to use both to really know how damaged the spine is. But these tests help you to locate the very particular areas where whether you're in the lumbar spine, you're in the cervical spine, so that better, more accurate, more precise treatment approaches can be made for these patients. We also teach you how to clinically correlate in our programs, how to clinically correlate your findings. We also show you that MRI is not always your most sound tool. It's a disc study, but a patient can have serious spinal ligament injuries and a lot of excessive motion without anything showing up on MRI. Now, you can also have a disc herniation that has no excessive motion at the joints above, below, or at the joint of herniation, and those usually conservatively treat very well. But where you have conditions where you have both excessive motion and disc herniation, those are some of the most challenging cases you're going to face, and that's where you're going to potentially need the help of additional procedures that can help get the inflammation reduced down in the area and really help to target the approach to getting the patient well. We also teach you that the craniocervical junction is oftentimes missed on the MRI, and that your X-ray testing procedures and measured displacements routinely show you where the problem is. Now, these conditions called spinal instabilities, we all know they can cause lower back pain. They're the #1 cause of neck pain, migraine headaches, pain radiating down the arms, pain radiating down the legs, shoulder pain, scapular pain, numbness and tingling, a sense of weakness or heaviness in the arms, same in the legs, ear pain, facial pain, severe fatigue. When you get to the craniocervical junction, concussive syndrome, disturbances in concentration, disturbances in memory, visual disturbances, ringing in the ears, dizziness, vertigo. Those are all symptoms that you are continuously dealing with in a spinal instability practice, or a practice that's focusing on these spinal ligament injuries. We also know that the chiropractic profession has a very scientific approach to the reduction of these spinal instabilities, and it has to do with the mechanoreceptors in the ligaments and how the adjustment affects those mechanoreceptors. We've gone over those points a lot before in other webinars, not the focus of this morning. But what we want to focus on this morning is there are going to be times when no matter what you do, that patient is not fully recovering, and now you're starting to go, okay, do I need a little more invasive help to get the inflammation to reduce down, and in the case of injury cases, to actually get the condition fully diagnosed, fully documented, so the patient has access to any or all benefits that they're entitled to. Now, the first logical step to your approach is usually not to a spinal surgeon. Surgery is not usually the next step. What is the next step, though, are interventional pain management procedures. Those are the things that we want to talk about this morning. That's why I'm very happy to have Dr. Donovan on. By the way, Dr. Donovan has a very busy day of procedures. He graciously allowed us to get some of his time today. He's actually mid-procedures in a day. I mean, obviously he's not mid-procedure, but he's mid-scheduling of procedures. So we're pulling him out so that he can talk a little bit more about what he does, what the technology that he does seriously improves all aspects of this level of interventional medicine. So what I want to do now is I want to introduce Dr. Donovan. Dr. Donovan is a board-certified orthopedic surgeon. He's the doctor that's listed in this image that you're seeing right now. He graduated and received his orthopedic training from Northwest University. He's been a practicing orthopedic surgeon since 1975. He was a major in the United States Air Force. He's the chairman of the board of a publicly traded company called Spine Injury Solutions. He also is Spine Injury Solutions is the company that has developed and owns what's called the Quad Video Halo, which he'll explain a little bit more about what that is, but that is a video system that makes a medical video record of the actual pain management procedures that the patient is doing. So with no further ado, Dr. Donovan, are you on?
Yes, I am, Jeff.
Okay, perfect. I tell you what, I'm so happy for all the doctors that are on today and also for myself that you took the time today. I know we talked before, I was like, holy smokes, I had no idea the busyness that you were on these days when you're doing procedures. But I want you to just spend a little bit of time. We talked about the three most important factors when doing an orthopedic referral. We have a lot of doctors in chiropractic on that may have made referrals, may not have. So what I want you to do, I know we talked about transparency, objectivity, and patient results, but I want you to talk now about that from the point of view of your company and the technology that you've developed.
Well, Jeff, it's my pleasure, and I want to thank everybody who's taken time out from their schedule to listen both to Jeff and myself. I'm an orthopedic surgeon. I've been in Houston in practice for about 40 years. My best and closest friends in Houston are DCs. I've been working with DCs since 1976, and I was one of the few orthopedic surgeons who would accept referrals. I never stole a patient or anything. So I've learned a lot about the spine from my friends at Texas Chiropractic College, the DCs. What Jeff talked about before I started talking, the spine instability, the ligament injuries, the use of CRMA, no orthopedic surgeons talk like this. And I would hope that Jeff can give this same talk to 100 orthopedic spine surgeons. We're focused on disc injuries, surgery. But let me tell you, most of the patients we see fit into this spine injury and instability that before CRMA, no orthopedic surgeon was picking up. Bending x-rays are not accurate. So because of my background in dealing with DCs for so many years, I want to tell you how me as an orthopedic surgeon feels and how how do the DCs help me in my practice? Look, we're all trained similar, except I go on and do surgery, you don't. And I think there's a lot of patients that we treat that we can't pinpoint stuff. And as Jeff was talking, there's a pain epidemic going on right now. And I think most of it deals with instability, stuff that we have never really talked about in the past. When I decided to really get into injury solutions, injury cases, I wanted to use my differential diagnosis technique and do video technology. So what I'm going to talk about is what I've been doing with the video technology over the last 3.5 years. Here's our typical case. Patient gets injured, gets good rehab therapy by the DC 4 to 6 weeks. Hopefully, the patient's had a CRMA, which identifies a ligament injury, or it says there's not a ligament injury. So and the patient may have an MRI. It may be positive, it may be negative. But our patients are still complaining of neck pain into the arm, headaches, sleep disruption, tingling and numbness, anxiety, TMJ dysfunction, depression, myospasm, everything we all know and we see with these patients. So where does an orthopedic surgeon, how do I approach it? Because we're working together. You're the gatekeeper. I'm the guy at the next level of testing and evaluating. Everyone here knows, many times we'll do an MRI to the neck pain down the right arm, and lo and behold, they read 2 or 3 disc herniations. Well, based on my clinical exam, I think it's C6 because of the numbness. Well, I need to do some kind of injection to numb that C6 nerve, or if it's in the low back, numb the L5 nerve root to see if the pain goes away. Well, I always felt we had to videotape these procedures. So over 3.5 years, when we started videotaping, I was focusing on answering 3 basic questions dealing with our patients who've been in an injury: the skepticism, the doubt, and uncertainty. Is Mrs. Smith really injured? And I felt that if we videotaped procedures, we would be able to answer those questions. Now, when we videotape, it's audio video. So you get both the patient's response orally and on video. And the 3 major things that we wanted to focus on: it had to be safe for the patient. It has to be transparent so that all parties know exactly what the patient went through, what the response, and then what were the results. Well, let me tell you something. 3.5 years ago when we started, I assumed wrongly that patients would refuse to be videotaped. We've done a lot of cases. We've never had a patient refuse. In fact, what we hear with patients, number 1, the doctor must be good if he's willing to videotape. Number 2, the doctor's not going to do anything he shouldn't be doing if he videotapes. So here's how we approach this, and we've been doing this with affiliated groups in Texas. The primary gatekeeper does the rehab conservative therapy. If they're not better in 4 to 6 weeks, hopefully the CRMA's been done, MRI is done. Patient then is sent to me for an orthopedic consultation. My job is to determine what is causing the pain. My job is not to treat the pain, but to find the cause of the pain. So I do a lot of facet blocks. I do a lot of transforaminal nerve blocks. We do some SI joint blocks. We do some ESIs. On certain patients, we'll do radiofrequency ablation to facets. We're using radiofrequency ablations to knee injuries, to the superior geniculate, inferior geniculate nerves on both sides. So, patient comes, and when you're referring somebody, say to an orthopedic surgeon, this doctor needs to understand Colossus using ICD-10 codes. Number two, doing a diagnostic nerve block injection or facet injection that is both diagnostic and therapeutic. So and that's part of the differential diagnosis. So it helps pinpoint what's causing the pain. Many times you probably sent patients to a pain doctor and he recommends a series of ESIs and so on and so forth. Well, that doctor's treating pain. What you and I need is to figure out what's causing the pain and what would be an estimate future medical treatment based on the correct diagnosis. So we focus on safety, we focus on better results, we focus on transparency, and the results have really been very rewarding, both in helping the patients with their pain, working with the gatekeeper, the DC, and developing affiliated doctor groups where we all work together. When I see patients, I have clinics in Houston, Odessa, I'm opening one in Lubbock. I see the patients at a DC clinic. It's better, the patients love it, they're familiar where they're going and so on and so forth. I think this is the future of interventional pain treatment and so forth. 3.5 years ago, everybody thought I was the craziest guy in the world doing videotaping. Whoever thought 2 years ago they would require police to wear video cameras? You know, whoever thought that? Well, when I started doing arthroscopic surgery in 1976, I was the craziest doctor in Houston. I was the only guy doing it. But I'm approaching the injury solutions the same way. That is, we have to be working together. We have to be able to visualize what's being done. And if you have pain doctors that you're referring to now, and they say, well, they don't want to videotape, well, find yourself another doctor. You know, the young docs who are really good, they love being videotaped. So I think what you need to know is what are the key issues in making a referral and what factors you take into consideration for orthopedic or diagnostic pain treatment. The patients need to have had the CRMA. We need to know the status of the ligaments. We obviously want an MRI. We work together, and if we do certain diagnostic blocks, they need some rehab therapy after. So what I'm looking for in this group is telling you about what our experiences have been with a lot of cases over the last 3.5 years. I personally feel doctors in an affiliated network, and it can vary from state to state, we have to have the gatekeeper working with the ortho with the interventional pain. The ortho may be the interventional pain, but we need to work together. And we have to use video technology. On this picture you see right now, that's me, and you'll see the halo. There's 2 video cameras attached to the CRMA X-ray machine. There's an LED light there. There is a microphone there. The monitor to the left, as we're doing injections, they show up on the monitor. We take that input from the monitor and put it on this 27-inch monitor that's right there in the operating room. There's a 3rd camera at the head of the bed, and that's how you can see me and the patient. So as the needle is going through the skin, you see in the left upper quadrant, you look at the X-ray right lower quadrant. In real time, you see the needle going through the skin. It's in the spine. You see the doctor. You see the patient. As that's being done, that goes through a couple little black boxes that we know the secrets inside, and then it goes right into the internet, and it goes up to box.com. We do not use Wi-Fi. The files are large, and we don't want any delays. This adjustable clamp that you can see up there is a black wire. This halo would adjust to any clamp. Now, we got the patent on this in 2015. The patent says an adjustable clamp attached to any X-ray machine that contains any kind or attaches any kind of recording device. It could be video, it could be movies, it can be photos, it can be audio. So that is the patent. We then took it through all the testing, the UL testing and everything. We have a CE mark so that it can be sold in the EU. But this attachment called the halo will fit on any CR machine. Now, let's say some of the docs talking today, Dr. Smith may have multiple clinics in a city or surrounding city. Say you have 5 or 6 clinics. We would pick out one of those clinics to do an affiliated program with Dr. Smith. You need a C-arm, you need the halo, you need the technology where your procedures can be remotely monitored in case any problems develop, so on and so forth. So I truly believe this is the future of any type of interventional pain diagnosis and treatment with injury cases. And you and I, we deal with these cases every day. And this helps. And by the way, it can be a tremendous marketing tool for, say, Dr. Smith in this town or Dr. Jones in this other town. The technology works. What Jeff has done, what we have done, we've taken smart technology and helped visualize the things that all doctors need who treat these injury patients. And we're just bringing it up with new concepts that work. And remember, it helps the patient. It really helps the patient. Jeff, anything else you want?
Totally. Well, I tell you what I want to do is I know from being a DC for years, I know the majority of doctors out here today do not know that these procedures are not routinely videoed. So today, if they're making a referral in for, say, an ESI or a nerve block or a radiofrequency ablation, one of the things, doctors, that I want you to understand is that these procedures are not normally videoed. So what Dr. Donovan and his company has done is they brought a whole new level of professionalism to this field. They're actually starting to really change the professionalism of the field. And the biggest thing that got me so excited about it was all geared around better patient results. Anybody who's videoed, and right now there's even science and research that is saying if a doctor is videoed, the procedures are better. And if you thought about it, if somebody had a video camera on you every day with every patient interaction that you had, obviously you would be on your toes. When these level of procedures are being done, mistakes can be made. However, these mistakes are significantly reduced when the video camera is on and everybody is able to see exactly everything that went on with that patient intervention. And the other thing that I think Dr. Donovan touched on that I really want to make sure and hammer home is that this seriously can save money on for everybody involved, to the patient, to the insurer, to the attorney that actually has to resolve the case, because if your results are better, the patient needs less results, needs less procedures. And so there's less costs involved with that, with that level of care. And that's what I got so excited about. So Dr. Donovan, what I want you to just kind of speak to a little bit is it's not normal for these procedures to be videoed, is it?
No, nobody is videotaping like what we're doing. Remember, we own the patent. It
Correct.
goes on the x-ray machine, and we know who has the machine. But let me tell you, brought up something really, really important. 4 months ago, a study came out of the University of Pittsburgh, and it was by interventional pain thing. Every doctor here has probably heard about wrong-sided surgery. Operate on the wrong knee, operate on the wrong shoulder. What they did at University of Pittsburgh, they were studying the wrong side or wrong levels that the injections were done, and they found it's 10 times more common. Doing it with video makes everybody more professional. And the patients come, after they've been videotaped, they come back and tell their gatekeeper referring doctor how pleased they are about being videotaped. What Quad Video Halo wants, we're looking for 5 or 6 different groups that will come in and work with you with an affiliated program. And we would do 2 in this city. We were just in Atlanta, and we thought we would do 2. Well, it's a lot more than 2 that want to do it, but we're saying you step up and get involved, and I think you're going to find out your patients are very happy. Our technology is controlled, and we know where it is. There's some people doing GoPros and stuff like that. It's not HIPAA compliant. What we do, where we store these files on box.com, that's all HIPAA compliant, has to be. So we've spent a lot of time and money making sure the system works for docs like me and docs like you.
Good. So just to recap, doctors, what Dr. Donovan is talking about is they started an affiliate program where if you have a level of clinic where you want to now bring in under one roof pain management services, they can show you how to do that. Or if you want to have somebody who you're looking to make referrals to actually have their procedures videoed. What I'm telling you right now, and being in private practice for 17 years, when I looked for referrals, obviously what you're looking for is when you need to make that referral because the patient is not responding the way you think it is appropriate, and you know that you need a higher level of intervention, you want that referral reflects on you. So if that referral is good and the patient result is good, it reflects very, very good on you, and that's what you're looking for. So it's either or. Either if you yourself are looking to bring, and we have medical doctors and doctors of chiropractic on these programs, if you're looking to bring pain management procedures into your clinic, good. This group is looking for someone like you to potentially put services in an affiliate system into that clinical setting, or if you have someone that you want to refer patients to where they are using this system, then we would like those names as well. That's what Spine Injury Solutions is all about.
Jeff, let me add one thing that we have found. Let's say I'm Dr. Smith and I have a network, 3, 4, 5 clinics around a big city or whatever, a good-sized city. I want to look for new patient referrals into my clinic. You want to go to family docs who don't want to treat auto accidents. You walk in and show them on your iPad, well, at our network, we videotape procedures because it's safe, it's accurate, and it gives us a visually based evidence of what was done. So you go to doctors, to primary care, to get new patients to your clinic. You go to attorneys and you show this, they will swamp you with cases because you're the only people that have this technology in a particular area. So I think if you want to get referrals from medical doctors, DOs, family docs who don't want to treat injury cases, it is a terrific way. And what's interesting, when a DC comes to an MD and says, you know, we videotape procedures, we pulled the curtain back about what we do, boy, let me tell you, that says a lot. And it says to the MD or DO, geez, these DCs aren't trying to hide anything. In fact, they're on the leading cutting edge of what's new and what's really good. So we've seen this, and I think Dr. Smith or Dr. Jones, these are important issues that I think will really help you.
I'll tell you what, Dr. Donovan, I'm a little bit mindful of your time, and I'm just monitoring the time because I know you've got to get back in procedures. So I'm going to start to open it up to question and answer this morning. I've already got some questions coming in, if you don't mind, Dr. Donovan.
No, that's fine, sure.
Okay, great. And anybody who's interested in your program, they would just call the number down below, 855-784-4111, or you would just use the email info@quadvideohalo.com. Okay,
yeah, just go on the website, you know, www.quadvideohalo.com, and it'll show you more stuff and who to contact and how and so forth. Sure.
That's perfect. Okay, great. So the first question I have, you'll like, is how do I get connected with you in the Woodlands, Texas?
Oh, man, call my office. Here, 713-453-8551. I would love to be in the Woodlands because that is an area totally underserved.
Perfect. So, you know, why don't you? I don't have any way of writing that onto the screen right now. Give that number one more time, if you would.
713-453-8551.
Okay, great. Another question I have, and I know, you know, I've heard that this is coming. Do you have a list of doctors using the video so we can see if it's in our local area?
Yes, we have them in Tyler. We have them in Odessa. We'll have it in Lubbock. We have it in Houston. There's one out in the El Paso area. We can, if you go to quadvideohalo.com, they'll talk, you know, what we want to tell us where you're from. Send emails. Let us know where you're from, and we'll follow up with you. Sure.
Minnesota is this doctor. Okay, so the flyer is about Atlanta. Who would I call in the New Jersey area? I work with a few pain management physicians in my area in northern New Jersey.
If you call, if you contact David Spencer, he's working with a doctor in New Jersey right now.
Right. The other thing, doctors, to know is that this can be in your local area overnight. It really can be. So, you know, all we have to do is connect with doctors. This is the way of the future. In the future, in the next 3 to 5 years, you won't have a pain management procedure that's not video. I mean, it will not happen. It's too protective of the patient. It's too protective of the doctors that do the procedures, right? Because somebody could turn around and say, look, the doctor did something wrong, or the doctor caused the injury. And when it's all on video, that's the transparency aspect of it. Nobody can really argue. Everything's right there on video. So, you know, what we're talking about today can be in your areas of the country overnight. I mean, all we need is a contact of who wants to put this technology into their clinic, so that everybody can take advantage of it. The patients, you, the insurance industry, everybody. Okay, so another question I have is, you know, how about the Philadelphia area? How about the Georgia area? Okay, good. That's coming. Georgia's coming. North Carolina, I'm getting. Hey, what about in California? What about in Oregon? What about, okay, doctors, we get it. Again, these can be overnight in your local areas. When I say overnight, you want to contact 855-784-4111, and we'll get information about, you know, who, either it's yourself that's interested or somebody that you'd like to take a look at this. Okay, I practice with PMR specialists in the Chicago area. Is there something that is set up differently from state to state? I'm not sure exactly what you mean by that, Dr. Donovan.
Yeah, in Illinois, it would depend on the structure, and that's pretty simple to figure out. And a lot of it deals with corporate practice of medicine. And we would love to have a PM&R in the Chicago area. I lived there 9 years. I did all my training there, and I would love to get back to the Chicago area. This would be perfect there because that's a big city, a lot of injury cases, and you could really market this to the family docs, certain attorneys, hospital emergency rooms. So I think that contact us through Quad Video Halo, and we'll follow up with you. Sure.
Good. So another doctor asked, you know, what would the cost be to set up the affiliate, to set me up as an affiliate with this system?
It'll vary. It'll vary in the structure. We have some that is set up for minimal investment per month. Some it can be purchased. Some it can be leased. If we have the right environment where it's being set up, and spine injury can purchase the AR so you get funding immediately, we work out what is the best. So with an affiliated program, an example, I'm doing injections today. I sell my AR to Spine Injury Solutions. So the procedures I'm doing today, I'll get paid next week. And I need to use the Halo, so I have they pay me a certain percent. Sure. Now, if a finance company came to me and says, well, we'll finance your procedures, I'll say, well, that's fine, but you don't have the Halo. I need the Halo. So I'm going to go with a finance company that has the Halo. There's only one finance company in the United States with the Halo. It's Spine Injury, because Spine Injury owns the patent.
Right. So essentially what you're saying, though, is if they were interested in an affiliate program, it's virtually at no cost. It's very minimal. There's a maintenance fee that you pay, but it's virtually at no cost.
That's great. I mean, the cost, you would pay for it in one day.
Good.
Yep.
So here's another doctor. Another doctor says, "Hey, what do the personal injury attorneys say about this?" Oh,
they love it. They go crazy. And you know, I over the years I've done a lot of depositions, and they would say, "Well, doctor, what did you do?" Well, I did a right L5 transforaminal L5 nerve block. They go into the next question. I know that everybody in that depot, videographer, court reporter, plaintiff attorney, defense attorney, had no idea what I just said. Well, now in the depots, they'll say, well, doctor, what did you do? I did a transforaminal L5 nerve block. Did you videotape the procedure? Yes, I did. Can you show it? Now everybody knows. That's a 6-inch needle going into the foramen, say at L5 right, bump the nerve, reproduces a pain, which tells us that's the nerve inflamed, do the injection. Now there's no question what we did. It's the transparency. I mean, everybody loves it. And the defense ultimately is going to love this because the insurance companies are going to use this technology to root out fraud. People billing for stuff they haven't done. Well, when it's on video, it's right to the point. It was done. Here's how it was done. Here's the patient's response. Attorneys love it because it's educational and they can see it. A picture is worth 1,000 words. A video is worth 1,000,000 words.
I'll tell you what, so well said. Plus, I love the fact, and this is why I got so interested in it, is that it really helps all parties involved. It helps the plaintiff.
Absolutely. Yeah, absolutely.
I mean, everybody involved, because the other thing that was so interesting when I started talking with you is how much could be saved just in minimizing the procedures. That effective procedures mean minimized procedures and serious savings on cost. But the other thing that I liked about it, Dr. Donovan, and I guess maybe stress this point, is that when, in your experience, when these procedures are videoed, it means that when the patient gets the benefit they're entitled to, part of that benefit is getting the doctor's bill paid. Your bill paid, the doctors that made the referrals bill paid, everybody's bill gets paid better, correct?
Absolutely.
Yeah.
And what we've had feedback from people saying it probably on routine cases increases things about 30%, maybe higher.
Yeah.
And and on some of the cases, it's much, much higher in commercial cases.
Good. So here's a question I have, and then we'll probably make this the last question because I know that that you I know with your time, I'm a little bit conscious of your time. What is this is a DC who says, what is the best way to approach a local orthopedist about this?
Wow, that's a great question. Well, orthopedic surgeons are looking for new referral cases, as are the DCs. I think if you go to an orthopedic surgeon and say, look, I have 3 or 4 clinics, I'm very busy, I would like to work with you on some orthopedic consults, and here's what I need. I need to find the diagnosis. And if they need injections, nerve blocks, do you do them or who do you use them? I would focus on the younger docs, the younger orthopods. Or I would go to one that's about 60 years old who's fed up with all the insurance companies. So I would go to the young ones or the older ones. Perfect. And orthopedic business is going down for everybody. So you as the gatekeeper, there's a great need for DCs to be working with ortho. And that's why I'm hoping that the quad video helps span that gap and bring us all together. I mean, that's the way it should be. It's the way it's been for me, gosh, almost my whole life here. And it's rewarding because the patients do better.
Dr. Donovan, I got one last question. I got a doctor who's asking this question over and over and over again, so I got to get it in. I got to ask it at least. The question is, can doctors buy, or can people buy shares in this Halo company?
Yeah, on the spine injury, it's the stock is the code is SPIN.
Yeah, okay.
That's the code, and the code's assigned by FINRA. Those are the people that run the stock exchange.
Gotcha.
But,
okay. So
Jeff, I just want to thank you. These are terrific questions, and I need you to give your seminars to orthopedic surgeons. I've learned so much from DCs over the years, And all back pain is not disc herniation pain, that's for sure.
Correct, correct. Boy, you got that right. Amen.
But I want to thank everybody for taking time and listen to me, what we're doing. But I'm passionate about this. And I devote my whole time on this because it's the right thing to do. So God bless everybody.
Absolutely. Dr. Donovan, thank you so much. Doctors, again, if you have questions or you want more information about Spine Injury Solutions affiliate program, just contact. You can look them up on the internet, Spine Injury Solutions, or Quad Video Halo, www.quadvideohalo.com, and contact them. Again, every week or every month we'll have 2 programs, and we're bringing in national experts on different subjects. I'll give webinars on different subjects. Doctors, thank you so much for your time and attention today. I know that you're busy, and I hope this information will be helpful for you in the future, both today and tomorrow. And thank you very much again. Have a great rest of the week. And for now, good day.